Hello and welcome to the fourth webinar in the IBEMCSN Patient Partner Training Series. This webinar is called Intro to Research for the Non-Researcher. In this webinar, we will define clinical research, talk about the types of clinical research, get an understanding of statistics and what statistical significance means, discuss peer review, talk about research outcomes and the difference in patient-centered outcomes, and then we'll end with a small recap of patient engagement. The objectives are to gain an understanding of clinical research and the types of clinical research, learn about statistical significance, learn what peer review is and why it's important to research, discuss outcomes in research, understand how patient-centered outcomes are different, and then once again we'll wrap up with a little summary of the importance of patient engagement. At the end of this webinar, you'll know how to use everything in this picture. Well, that's not exactly true. The goal is not to turn you into a researcher. You don't have to become an expert in the scientific method or anything like that. But if you think back to the PCORI engagement principles, co-learning is one of them. And what we want to do is to help you understand the research process broadly and in a very general sense, just so that the work that you do on this project will be more meaningful to you. Understanding the research process will help you determine where your expertise fits. Here we go. And your experience and where you might add benefit to this project. In the Quest and the PKU project, both, we do literature reviews, we do environmental scans. What that really means is we research the research. We find out what's out there, what's already been done, what the results were, what they mean, who in the field is doing the work, and what the gaps in knowledge are. And so some of this might be things that you're interested in working on, or if not, you just want to have a better understanding about what it means. So it's important to have kind of a general understanding of the research process. So the definition that we're going to use for clinical research is studying human volunteers to establish medical facts and improve medical knowledge. There are two different types of clinical research. Clinical trials are where participants are assigned to receive specific interventions according to a research plan. You might have heard of like testing a hypothesis, seeing if something works or doesn't work by comparing two different groups. That would be a clinical trial. Observational studies are, people are not assigned to specific interventions. It's what it says it is. It's more observational. People look at people in their typical setting and just see what happens to them. It's important to understand the context when you're talking about research. Take a look at this slide. A man has one hand in a bucket of ice water and the other hand in a bucket of boiling water. How do you think he's feeling? Well, on average, he's feeling great. And that statement is certainly true, but when you look at the context and think about what it really means, it's ridiculous. And you can really say anything with statistics, so the context of what you're doing and how you're doing it is really important. There are different types of statistics that people use in research. Descriptive summarizes information. Examples of this might be average, maximum, minimum, account. It tells you about it. Associational is research that establishes a relationship between two or more items. Here's an example. People who use black pepper get cancer more often than those who don't. This might be true, but the important thing to realize is that this is different than saying that black pepper causes the cancer. So that's an area where we have to be careful with statistics and how we use them. Causal establishes cause and effect. An example is high protein foods increases Phe levels in a block of patients with PKU. And that one you've established that there's actually something to the relationship scientifically. Saying that something is significant implies that an appropriate statistical test was used to determine the relationship between the two variables. And you will see that phrase in a lot of the research that we look at in the studies that they review, that something was statistically significant. So that means that they've done the correct analysis on it and they have found this causal relationship. Another topic that's important for us to know as we go through this process as patient partners is peer review. And peer review is a process by which a proposal is evaluated by a group of experts in the field. And peer review is meant to help validate research. It establishes a method by which something can be validated and increases networking possibilities within research communities. So, for instance, you have some of your peers in the field. A geneticist would have some other geneticists reviewing their work and making sure that it could be held up to a certain standard. So having research validated is very important. Peer review helps you gauge the credibility of the information when you're interpreting results or drawing conclusions. When we review materials related to our work, you should always find out if the information has been peer reviewed. Having said that, it's not foolproof, but it's just one more indication that there's something substantive to the research. What does an outcome mean in research? An outcome, in general, is just how something turns out. In research, what we mean by outcome is it's an end result, often assessed by a lab test or some other observation by a researcher or a clinician. So when someone conducts scientific research, they are looking for a particular outcome, if something did happen or didn't happen, or why or why not it happened. Patient-centered outcomes, however, focuses on research topics, questions, and outcomes most important to patients and those who care for them. So what's a patient-reported outcome? A patient-reported outcome is an end result assessed by the patient based on how they feel or what they've experienced. So it's an outcome, but it's reported by the person who was involved in the study or the trial. So take a look at this cartoon. I think it's just kind of humorous. It's time to administer the patient satisfaction survey. It's asking the patients what they think about the outcome of the results. Do patient-centered outcomes matter? And here we have a picture of, the surgeon saying, "Brilliant surgery, it's well done. Shame the patient died," which I think, is a joke, but it kind of highlights the fact that patient outcomes might be different than those of a clinician or a researcher. You can have a technically perfect surgery, but if the patient died, it's not really that successful. And we've used this phrase before, and here it is again, nothing about us without us, patient-reported outcomes. So again, these are measures that the patients and their caregivers care about. They measure outcomes that only a patient or a caregiver would know. They'd have to be the one reporting it. Like when a clinician asks you, "How's your pain today on a scale of 1 to 10? How do you feel?" The patient is the only one that can answer that question. Patient-reported outcomes can provide valuable insight for clinicians, and it's the only kind of research that PCORI funds. Identifying outcomes important to patients and their family is part of the work that PCORI does, and it's what we do in the IBEMCSN. Here's a picture of a mind map that we did with our PKU project. And the question in the center was, what outcomes are most important to you? What are the things that matter to patients or caregivers for people with PKU? And you can see there were many things up there, and there were many issues and outcomes that people brought up that hadn't been addressed by research at all. We had topics such as performance in school, which might not be a typical clinical outcome that a doctor might be looking at, but which a parent of a child with PKU is very interested in. Does the PKU and Phe levels affect their child's performance? We talked about women's health and as they age, menopause and those kind of things. Is PKU going to ultimately affect that or make any differences for those women? So as you can see, that again was not a topic that has been identified in the research of concern to clinicians, but it's something that the patients themselves were very interested in. So the patient-reported outcomes can be very different than what the clinicians want to look at. There were also many that were very similar. We talked about the simple diet versus the traditional diet, and there have been some studies in that, and the patients identified that as something also important to them. So when we were doing this exercise, we were discovering things that patients came up with that clinicians had never even thought of. Indeed, our clinicians shared that there were issues that it would never even have occurred to them to want to study. And then there were issues that both agreed were very important. And then there's probably going to be issues that clinicians are really concerned about, but they may not matter to the patients. That might not be what their overall goal is based on their values and their perspectives. When you measure patient-reported outcomes, what we've done in the PKU project, for example, is we've used the Promis Measures, and this resource will be provided to you on our website. Promis is Patient-Reported Outcomes Measurement Information System, and this is a set of person-centered measures that evaluate and monitor physical, mental, and social health in adults' children, and you can use it with the general population or individuals living with chronic conditions. And if you go to their website, you can look up different types of measurements that have been validated. And so as we discussed, that's an important criteria to know that it's a reputable tool. There are measures based on social, emotional criteria. There are physical measurements, such as how are you feeling today? What's your pain level? Are you able to concentrate in school? Are you worried about things? Almost anything that you can imagine is in there. And as we go through our projects, the Promis Measures have been a really good tool for us to go through, read through them, and see if they apply at all to the outcomes that we've viewed as important in our project. So I would encourage you to take a look at the website and just go through some of them and get an idea for what kind of things you can measure with patients and what kind of measurement tools are already out there. So as we said at the beginning of our training series, the Inborn Errors of Metabolism Collaborative is a database with over 2,100 patients, about 30 metabolic specialty clinics across the country, and they've been following patients with inborn errors of metabolism. It's the largest database of its kind for patients with inborn errors of metabolism. But as you might remember, patient input was not directly considered in developing this resource. Nobody asked the patients about their outcomes and what they thought was important. It's all clinical data. So as you might guess, PCORI and the IBEMCSN sees this as something lacking. Clinicians don't even agree on some of the conditions. In our QUEST project, for example, we're looking at inborn errors of metabolism with uncertain clinical consequences. And what that means is that there are some conditions on the newborn screening panel where babies are identified as having a condition. Sometimes they are, the parents are notified. Certain states, they may be screening for things that they don't report out because there's a real controversy as to whether or not these conditions will result in clinical consequences, such as will the baby get sick? Will the baby have adverse health outcomes because of the issue, because of the condition? And is treatment necessary? Does treatment even make a difference? And there are great differences in opinions of clinicians, and therefore there's great differences in approaches to care management for these patients. Some doctors, like I said, identify them and treat them and follow the patients. Some states and some doctors don't think that these patients need to be labeled with a disease because they don't believe it to be a disease. They don't believe there needs to be treatment, and they don't believe that any type of intervention would make a difference in outcomes for these people. So this is where patient-reported data can be really important to put with that clinical data, because there are outcomes that patients have experienced that would give doctors more information about really understanding the whole scope of these conditions that they've identified and what they might mean. So the QUEST project, for example, we feel that if we combine the patient-reported data to the clinical, we're going to get better information. Ultimately, we're going to get more meaningful outcomes for patients. So once again, just to recap, that's why PCORI and that's why IBEMCSN thinks this is so important. Patient-centered outcomes research helps people and their caregivers communicate and make informed healthcare decisions, allowing their voices to be heard and assessing the value of health options. Nothing about us without us. Patients as researchers means that given my personal characteristics, conditions, and preferences that I have, what should I expect will happen to me? What are my options and what are the potential benefits and harms of those options? What can I do to improve the outcomes most important to me? And how can clinicians and the care delivery systems they work in help me make the best decisions about my health and my health care? And once again, just to close out, I'm going to read again the quote that I really think is the essence of PCORI and the work that we're doing with patient engagement and why it's so important to scientific research on inborn errors of metabolism. Engagement helps ensure that the research we fund provides information that patients, their caregivers, and the broader healthcare community need to inform the decisions they face daily. It brings insight and experience often missing in traditional research. This makes it more likely that researchers will study the right questions and that results will be patient-centered, trustworthy, relevant, and taken up in practice. Thank you for joining our webinar series. We have 4 of them posted on the website and on our YouTube page. We will be posting the accompanying resources. As always, we hope that you will feel free to contact us if you have any questions about the webinar series or any questions about our projects. Thank you.